皆さん、こんにちは。グローバル化というようなことがいろいろな分野で叫ばれてますけども、医療や教育の面もその例外ではありません。海外のいいところと、それから日本のもともとあるいいところを両方取り入れていくことによって、いろいろな分野でね、ますます発展するんじゃないか。グローバル化っていう面では、我々は今までの、プレゼンターの人もそうですけども、若者たちにですね、ぜひ海外に行ってくださいと言ってるんですけども、このインターネットの社会で情報はどんどんどんどん、日本の中にいてもですね、入ってくるわけなんですけど、やっぱし現場に行って、そこでフェイストゥフェイスで、インパーソンで、対面で人と会って、いろいろな学ぶということは非常に重要なことで、そういう意味では、日本の人たちが海外に出てくること、行くことを奨励してるんですけども、一方では海外からですね、わざわざ日本に来て、くださって、フェイストゥフェイスでいろいろ教育をしてくれる人がいます。今日のプレゼンターであるラン・ゴールドマン先生はですね、過去何十年と日本と行き来しまして、カナダから、そういうことを、教育をね、してくださっていますけども、専門は、ペディアトリック・イマージェンシーって、小児の救急っていう分野で、救急は大人にも起きますけども、当然小児の分野でも起きることで、えやや小児の場合はさらにね、特殊な環境っていうのがあると思うんですけども、そういうことも含めて、小児科の分野の救急、そしてそれが未来一体どうなるか、さらに彼の経験からですね、若い人へのいろいろなアドバイスを本日いただきたいと思いますので、ランにお願いしたいと思います。Ran, thank you very much for being today. Uh, from now on, let's start in English. And first,
Thank you.
I want you to introduce. Hopefully, you can tell us something important for the young generation.
ありがとうございます。よろしくお願いしま
あ、
す。
こちらこそ。I think now you can speak Japanese a little bit, yeah?
No, no, no. Nihongo, no, not good, but it's a great pleasure to be here, and thank you for the opportunity to speak with early career physicians.
はい。
It's always a pleasure. I enjoy every time I meet a group of physicians in Japan. The passion, the hard work, and the management of patients is admirable. I love to see this. When I go back to Canada where I work, I'm always with new energy
Oh,
and
good.
happiness to look after my patients after seeing how people do that in Japan. So, Junji Sensei, arigatou gozaimasu. Thank you for
Okay.
having
Number 109, 未来の医師への贈り物 Present to doctors to be in future. Professor Ran Goldman from Canada, Vancouver, Canada. Uh, his catchphrase is say yes to opportunities. Okay, now you
Yeah,
can all yours, so you can start yourself.
I will explain the catchphrase very soon.
Okay,
Um, and it's really important. There's only one message that people need to take from our session today, and it is saying yes to
okay,
opportunities that happen in your career.
good.
If anyone cannot wait for the end of this session, this is the only one thing they need to remember.
I see.
Uh, let me tell you a little bit about myself. Like many others, I've started my career in medical school, and this was a very difficult time because you have to learn new things. You learn a lot. You work with your colleagues, and just like in Japan, when I went through medical school, there were times where I said, I'm not sure this is for me. When you're tired, when you're
Hmm.
exhausted of studying, you think, wait a minute, my friends finished their studies much earlier than me after 3, 4 years in university. I'm still in a program that was 6 years of medical school. And there are times where you want to quit. You want to say, enough, I had enough. But somehow I went through and finished medical school and then went through a program that is called rotational internship. This is exactly what is R1 and R2 in Japan. You
See.
move between different departments,
Uh,
whether it's surgery or internal medicine, community pediatrics, community medicine, where you go and see people in a clinic. And I really liked it. Today in North America, there's no more rotational internship.
Right.
You just immediately after medical school, or actually in the last year of medical school, you need to decide what you're going to do for the next 30 years or 40 years of your career, which I find really disturbing, really difficult. Because how do I know, in the midst of the anxiety of medical school, hard studies, taking loans in order to pay for the medical school, you need to make a decision for what's going to happen in 30 years. So I think R1 and R2, junior resident in Japan, is the best solution. I don't think many residents recognize this in Japan. When I meet young doctors rotating and doing a lot of difficult jobs, they're not happy. They say, oh, I don't want to be a surgeon. Why do I need to do surgery? I think this is the foundation to actually know what you want to do later in life.
See.
And for me, this was the time that I decided that pediatrics, Shoni, is the profession that I want to be in.
I see.
And without this rotational internship, I would probably not know that. I would go to something that sounds good, but I've never really experienced.
See.
So I would say cherish the time in your rotational R1 and R2. This is the best time to decide what suits you. Is this the profession you want to do for the rest of your career and work through? And then deciding that I want to do pediatrics, I applied for residency position. And you go and give your curriculum vitae, you give your resume, and you tell people, oh, I really want to be a pediatrician. And a lot of other people wanted to be pediatricians. It wasn't easy to get in. But it's the rotation that I did during the rotational internship in the same hospital where people knew me and recognized that I'm willing to learn and work. They said, you're going to be okay. We'll take you into the residency in pediatrics. So here is one more reason to do the rotational internship. You get to know real people that do the job.
Yeah, that's
and
true.
To make an impression on them that will help you build your career. So I started residency. I was the happiest person on earth doing work in residency in pediatrics. And I did 5.5 years of pediatric residency. It's longer than in Japan, but it allowed me to also do some research for 6 months.
I see.
Rotate through multiple rotation in pediatrics. So obviously the pediatric ward, where you see patients that are admitted to the hospital, but also we served for 6 months in a clinic in a village or in a city, where you learn what is really happening in the lives of children and their families. Not only those in the hospital that are usually very sick, but how do you take care of healthy children?
Right.
Give them immunizations, make sure they grow appropriately, make sure they get what they need from their parents. So a first screening for potential abuse or neglect, this is happening in those clinics. So hospital research, community pediatrics, we did rotation in pediatric surgery, which is not usual pediatrics. It's much more surgeries, but in young children or babies. And it was very enriching. 5.5 years where every day when I came to work, I knew that this is what I want to do for the rest of my life.
That's good.
Yeah, it was amazing. One of the rotations you have to do when you're in pediatrics is emergency, Shoni QQ. And you have to understand the spirit of Shoni QQ is very different than everything else in pediatrics. People that work in Shoni QQ are fast, decision makers. You have to make decisions fast. You have to do a lot of procedures. So it's a little bit between
It's like a
medicine.
surgeon.
Exactly. It's between surgery and internal medicine. We do a lot of procedures in the Shawnee QQ, and many of them are urgent. You have to make the decisions, and you need to have good hands, like a good surgeon. You, Junji Sensei, you know what I mean. When you need good hands, and also you have to understand the psychology of parents and families. You need to understand why they came to the emergency when the child is sitting on the bed, playing on their computer, and are smiling at you. So doing this rotation, I really enjoyed the fast pace, the decision making, and the fact that in a very short period of time, you can turn a very sick child to being much better.
Outcome is very quick also.
Children get sick very fast, but also get well very fast. And that's the beauty of pediatrics. So I decided, Shawnee QQ is becoming a fellowship in very few places. It became a fellowship specifically where you train for 2 years how to do what needs to be done in the Shawnee QQ. So I decided to do that. And I was very fortunate that shortly after finishing my residency, I got accepted to a very distinguished program in Shawnee QQ in Toronto, Canada, and the Hospital for Sick Children, which is world-renowned. And I've learned there in 2 years of pediatric emergency medicine, I've learned more than in the 5.5 years of pediatrics. Because you see patients from all over the world. You see patients that are the most sophisticated treatment is needed for them. This is not a tertiary hospital, not a quaternary hospital. It's the 5th level.
I see. So you speak French too in Toronto?
No, I wish. My French is a little bit better than my Nihongo, but not as good because in Toronto, or where I work and live now in Vancouver, there's very little French-speaking people.
I see.
It's more on the east coast of Canada in Quebec. So my French is not good enough, but don't tell anyone. So, I finished the pediatric emergency and decided that one of the areas that I enjoyed most is the decision-making around medications. When a child has an ear infection, what is the best medication to give them? And what dose is needed? And we didn't have good answers for simple questions like this. So I decided to do another fellowship and learn how to do clinical pharmacology. Now, I want to explain what that means because not everyone knows. This is not pharmacy. This is not the person that goes to the pharmacy behind the counter and dispense the medications. Clinical pharmacology is academic work and clinical work with patients to decide and understand what's the best treatment for them in their condition at that period of time. So I'll give you an example. Analyzing adverse events. So all medications can cause side effects or adverse events. And clinical pharmacologists would discuss, review the literature and the research, and make decisions for the clinical team. What should be done? Should you change a medication? Should you switch to a different dose? Should you continue with the same drug because the side effects are tolerable? It's okay to experience them by the child. Or you need to find a completely new class of medications for this patient. And I'm talking about very complicated, complex patients. So I've learned clinical pharmacology while working already in emergency, which was a wonderful combination. And that I said, more than 12 or 13 years of training is enough. And then I was fortunate to be taken as an attending physician, as a physician in the hospital for sick children in the emergency.
Yes. In Vancouver,
It was in Toronto first.
in Toronto first.
I worked for 10 years in
Oh,
Toronto and enjoyed every day. There was not a single day I didn't enjoy the work, but I was fortunate to know a lot of people around Canada and do research with a lot of people. And eventually my name got out and I was recruited by the Vancouver BC Children's Hospital to be the head of the emergency at BC Children's, which was a great honor and the best opportunity of my life. So I asked my family, they said, sure, we can move with you. And we moved to Vancouver. That was not far from 20 years ago.
Oh, I see, I see. Okay. Good history.
Yeah, that's it. That's in terms of who I am. And you heard through my description of my building of the career what areas of interest I have. And first and foremost, one of the best things that happened to me is that when I was in medical school, and I'm going back to medical school, I had outstanding mentors. And they said, you can promote the care of patients every day when you see them, when you take care of them, when you give them prescriptions. But if you do research, you can impact the lives of patients that you don't even know.
Patient.
You don't even see them. They're not on a stretcher in front of you. They're not even in your hospital or your country. By doing clinical research that is pragmatic, meaning practical, you can make a big impact. Right. And I took it to heart. And this is one of the things I want to tell whoever is watching our conversation, to be aware that if you add clinical research to your clinical work, the impact that you make is way beyond the walls of the hospital.
That's true.
So I enjoy doing clinical research. I think that one of the areas within clinical research is how do you do research in an ethical way? In Japan, in Canada, in many, many other countries, there's the Research Ethics Board. This is a group of between 10 and 30 people that sit around a table and they see proposals for a research study. And they say, wait a minute, we're not responsible for the patient. We don't have responsibility for the investigator. We have the position to decide, is this research project ethical or not? Should children and their families agree to participate? And I think there are a lot of interesting questions around the ethics of conducting research. And I sat for many years on a research ethics board in order to help investigators do research that is going to be ethical and scientifically good.
I see.
The next area that I'm interested in, and many of my colleagues in Japan know, is I'm interested in reducing pain in children in the Shonikyukyu. I told you already, we do so many procedures. We take blood tests. We fix bones that are broken. We do a lumbar puncture, poking them in the back. We do so many other procedures, suturing a laceration, a cut in the face or on the hand, and many other procedures. So it's really important that we cause pain and we try to reduce this pain as much as possible. And throughout 20-something years of research, I've been trying to learn what would be the best way, best medications, best opportunities to reduce the pain that children feel in the hospital. And together with other investigators, with other clinicians, I think we made a huge progress thanks to the understanding that children feel pain and we need to deal with it.
Mm.
Well, the next item I'm interested in is pediatric medications. I already told you that I've been very interested in understanding which medications to give children. And it's not always antibiotics. It's not always anti-seizure medications. Today, we have more and more innovative drugs, monoclonal antibodies for conditions that are affecting or affected by the immune system, ulcerative colitis, Crohn's disease, atopic dermatitis, psoriatic arthritis. So many conditions rely on the immune system. And the advancement in medications and getting to those monoclonal antibodies have been one of the greatest advances in recent history of science. And I'm very interested in this. I'm also interested in genetic treatments that are now coming up for cystic fibrosis. There's not a lot of cystic fibrosis in Japan. We do see more, but this is a condition that for many, many years people studied and did not have good solutions. Now, with changes in the genes responsible for a lot of the mutations of cystic fibrosis, we can help patients much more than before. Genetic treatment for sickle cell disease is coming up, and many other conditions that in the past children unfortunately died. Now they can get cured, not only treated, but cured for life. So I think this is amazing. And the next generation will have more and more medications like this.
This genetic treatment is also related to the ethics too, right? Because of
Absolutely.
many.
Absolutely. For many reasons. I'll give you one reason. You're absolutely right. We don't know what are going to be the long-term effects of changing your genome.
Right.
People talk about the potential that those children that now are getting genetic transposition, genetic changes, may 20, 30 years down the road have cancer.
Right.
We don't know if it's true or not. It's all new. So I think understanding the ethics of making the decision, and it's not the child many times, it's the parents that need to take the decision for their children when something may happen 20 to 30 years from now, is very interesting.
I see.
I'm hoping that the audience of this conversation will send me an email. Tell me what you think. What do you think about the ethics of genetic treatments today for children, decision-making by their parents? That's a fascinating conversation.
Particularly the elderly people, if we do something genetic treatment in a long period, they may die before anything happens. But for particularly children, they live like 60, 70 years, so it's a very important issue, I think. Right.
I totally agree. And finally, the two other items I wanted to mention, obviously emergency pediatrics. I'm very passionate about this. And fortunately, my colleagues in Japan worked very hard. And now there are the first few fellowships in emergency pediatrics. So people that are willing and interested and want to do this have a few positions, a few places where they can learn to do Shawnee QQ. And that's amazing.
So you have to come to Japan more frequently to guide them.
I hope so. And Junji Sensei, you know my passion about international medical education.
Right,
yeah. And Japan is the place I love to come the most because people are eager to learn. They're willing to open their minds. And you've run so many successful programs for junior, senior medical students and nurses and everyone in the medical profession that want to get educated. And we don't have enough educators in the medical fields. We need more. And I hope people listening today will take this into consideration. If research is not something you want to do, at least take advantage of the need for educators and spread the word.
Right.
Whether you're internal medicine, surgery, or family medicine, teach the next generation.
It's important.
Experience is very important. So I really enjoy coming to Japan. I keep looking for new opportunities to meet physicians and other healthcare professions in Japan and try and tell them what I know, not only on the medical aspects. Physicians in Japan are very good at medicine, but maybe to talk more about how to do research, how to keep enjoying your job despite the stress associated with doing medicine. We see a lot of burnout, both in Japan and in Canada and other countries. So how can you deal with such a high stress conditions, patients and families that need support and still enjoy what you're doing? So I like to speak not only about clinical topics, but also how the life of doctors can be better.
Yeah, that's right.
What do you think?
Yeah, I agree. That's the reason, another reason why I'm coming. I'm in Hawaii, but I come to Japan frequently, and hopefully my experience helps them to clinical, educational, research, and other, aspect of the medicine. Yeah.
Yeah, I think that's as important and as knowing the clinical signs and symptoms and the dose of a medication. It's knowing to be happy with what you do, reduce fatigue and burnout, and make sure your career goes for a very long time. And it's actually not very hard in the end of the day to do your job in a positive manner. There are a few things that are important. One of them is sleep. And I know that doctors in Japan don't get enough sleep, but things are changing. The government in Japan, I've learned, and I'm hearing from my colleagues, have understood that you can't stay up and still do a quality work for a very long time. So there is a need to understand the physiological needs of people, including doctors. And I think we're seeing a shift, and residents are going to get a bit more sleep.
Yeah, I think I think this year, pretty soon, they're going to change some system so that people don't get burnout and tired, but more effectively work, in a clinical situation.
Very glad to hear this. That's wonderful. Well, you asked me, and I'm very briefly, it's a lot of words on the slide, but very briefly, I just want to tell people of a few opportunities that I received over my career. And we're getting closer and closer to talking about the catchphrase, say yes to opportunities. In the beginning, I mentioned that in 2002, I worked in both the emergency and clinical pharmacology in this fantastic hospital in Toronto, Canada. And then I started, as part of my research and interest in medications, I started a group called Pediatric Research in Emergency Therapeutics, studying, doing research and publishing. How do you take care of children with medications, not only in emergency, but also in any acute care? I moved to Vancouver for an amazing opportunity, as well as to the Research Institute in Vancouver. And that was an amazing move. First, I think people that listen to us know that Vancouver is a beautiful place to live.
Yeah.
And we have a lot of Japanese people that live here. The reason is it does remind them of Japan. The mountains, the shores, the water, the ocean that we have here, very much reminding people of Japan. And very importantly, we have 20,000 sakura trees in Vancouver that were the present from the Japanese emperor.
Oh, I see.
So this is another reminder. We have Sakura in April or May, another reminder to people that this is a beautiful place to be.
I see. I have to go there. I never been before.
You must. You're usually going the other direction from Hawaii to Tokyo, but please come and visit.
Okay.
One of the times that I said yes was to become an assistant dean of continuing education.
See.
In our university, like many other universities, there's education for doctors after they graduate. And we call it continuing education because the beautiful thing about our profession as doctors, as people in medicine, is that you cannot stop learning
That's right.
anytime. If you stop learning the new things, you're going to go back. So continuing education is very important in the university so doctors can continue and learn. And I was the dean for learning after you graduate. And when I was asked to do this job, I was thrilled because I get to improve my teaching, to get others to help teach doctors, prepare conferences, and get to know people from all over the world. So this was really good. I continued to open the first clinical pharmacology division in our university for children.
I see.
I opened something called Med School for Parents, which is telling parents a bit more about the health of their children, a project. And recently, recently is from 2017, I am a member of a group called the Canadian Agency for Drug and Technologies in Health. This is a body that belongs to the Ministry of Health of all of Canada. And people sit in committees, and I sit with very smart people in committees that decide based on the evidence. They decide which is the medications that should be given to Canadians all over the country. New drugs are coming all the time to the market, and they may even get approval to be sold. But the question is it a good choice for patients? Is it a cost-effective choice for patients? And this body is looking at the evidence and gives a very robust answer. Should this new drug be used or not used? Should the taxes in the country pay for this drug or not? And again, one more opportunity when I was asked to do it, and I said yes. I did not regret it for 1 minute, because people think, oh, you're a professor, you go and you talk about things and you make decisions. No, it's the learning that I received through this process that enriched me the most. So I'm still part of this, and I enjoy it very much, and want to recommend to people to go to a website called Canadian Agency for Drug and Technologies in Health, CADTH, and take a look what they do.
Okay.
Finally, very recently, I started doing a chair of another group in this Canadian Agency for Drug and Technologies, and this is post-marketing drug evaluation. So let's say a drug was developed over many years, sometimes 10, 15 years. Let's say that it got approval that the drug company can use it because it's safe and effective. And let's say that Canadian bodies decided that it should be used because it's cost effective and of benefit. What happens then? We stop looking at the drug. Is it still good? Maybe there are new drugs in the market that are better. How do you make those decisions? And the way to make this is to have a good, robust data
I see.
and do research on this data from people that used the drug. So this is the post-market drug evaluation
That's
body.
very important. Yeah.
Yeah, and we never thought about it. We said, okay, phase A, phase two, sorry, phase one, phase two, phase three, and now you can use the drug. What about phase 4 after the drug is used? And that's what we're trying to learn and do. What's the best way to monitor drug use after it's approved?
I see.
That's it. That's the story. So it's saying yes. It's saying yes to opportunities that in the end of the day, I'm not only contributing to them, but I get back and learn more and have to keep up with the literature. I told you that my family moved from Toronto to Vancouver. This is a big country. Canada is the second largest country in the world. So we're big. You have to drive 45 hours to get from one place to another. Don't worry, I didn't drive. You can fly, and it takes 5 hours flight. So it's a long way. But what I wanted to tell to people is, I started in Toronto, as I said, and thought this is where I'm going to be throughout my career. This is a fantastic, one of the best hospitals in the world. But when the opportunity knocks, when people say, hey, how about coming to a smaller center that is trying to grow and to develop? How about coming and helping us develop a better Shawnee QQ? You have to really think hard. And it's not an easy decision to leave a place that you like. It's not an easy decision to leave a place where your children and your family is enjoying themselves. But saying yes sometimes is the right move. And I want to give you an example. For me, this was the right move almost 20 years ago, to go to the very other side of the country. And it gave me opportunities that I did not have before. So sometimes you have to say yes. And I want people to recognize this because it's very scary. When you have a fork in the road and an opportunity comes, it can be very scary to make a change. And I want people to overcome this fear and recognize, okay, what can happen? Yeah, it could be not very successful, but if I don't take this opportunity and say yes, I may never know if it was a good opportunity or not. What do you think?
Really understand. And my life is also kind of similar, challenging to the new place. It's always somebody said like get out of the comfort zone and the challenge to the new place. Although it's kind of sometimes risky and very difficult, but that's your life. So when you decide, I think that's a good decision usually.
Yeah, I agree. A change is a good thing.
Right.
I find that the new generation of people, both in medicine and in general, is finding it hard to make changes. It could be the corona pandemic that we had. It could be online. We all live online now, but people find it very difficult and anxious, provoking to make changes. And you know what? Even small changes are sometimes difficult to do. So my recommendation is, as you say, open up to changes, embrace them. It should be part of life. Now, I'm not saying every 5 months you should change your job. But I'm saying is, if there's an opportunity, you need to think about this and sometimes take it with both hands and move forward.
Right.
And a beginning is never easy. A beginning can be very difficult. but you have to take it and make the most out of it.
Yeah, that's true.
So one of the opportunities that I've enjoyed the most is coming to Japan and have an opportunity to meet people like you, like many others that are busy teaching, busy telling other people about our wonderful profession and what can we do better for our patients. And you can see on this list, I was able to meet physicians and teams of doctors in very many places
In places.
around Japan. I'm very honored, and this is a list from the last 15 years. So it's been amazing. I can mention two places that I think I've been visited more than a few times. First in Fukui with Hayashi Sensei, that I think many of the audience to this recording are aware of, a brilliant emergency physician that is a family doctor as well, doing family medicine style in the emergency, and really innovative, amazingly across Japan in what he's doing in Fukui. And also in Okinawa, in the Chubu program, I was very fortunate to be a consultant and learn from the team in beautiful Okinawa and really learn about the culture, the traditions of the Ryukyu people, but also meet the teams in Chubu Hospital. So those are two examples, but I've been very fortunate to be in other places. So again, one led to another. This is not something you do in one day. You go to one place.
I think you have already scheduled to go to Tube in November this year. Thank you
I'm
for your
so
help.
looking forward. I'm so looking forward to this. And you know, sometimes you have to innovate. Sometimes you have to think outside the box. And my fortune brought me together with two other phenomenal physicians. I mentioned Hayashi Sensei already,
Right.
and Fujitani Sensei, brilliant doctors. I've been the least brilliant in this group, but together we developed an international medical medicine festival.
That's a great, seminar.
We meet with 100 new physicians, early stage physicians. This was before the corona, and I'm very hopeful to do it after the corona in the next few years. Go back to this tradition of spending a weekend very closely together with outstanding speakers and outstanding audience of physicians that want to come, want to learn, and want to put their mark on the Japanese medicine. And it's called international general medicine because it's not just pediatrics. It's not just emergency medicine. It's 5 different specialties that come together, and this is the unique opportunity to be together. And many people also know that I've been very fortunate to work with CareNet TV, and some people enjoyed the jokes that we tell on this satirical show. We describe research with Dr. H here and Dr. G. We describe new research in medicine in a very casual way. We're trying not to be too serious. And we've had 5 seasons of this already. And this is just a lot of fun to teach in a very new way. So, you know, I've been very lucky to this, to do this, and can't imagine what comes next.
You see, the hero is a very, very nice person. He's a very passionate in teaching, but also passionate in maybe smiling or laughing.
Yes, he understood early on the humor is a great way to learn.
Right.
And I keep learning from him. And I think, you know, he wrote so many books and he's teaching in so many places. Just to absorb his energy makes me work harder.
Mm.
So, I want to make sure we're on time. So I'm just going to touch a few things that I want everyone to be aware of. First, we are clinicians. We came to this profession to take care of patients. There's no question. Clinical work is probably the most important thing we do. Whether you're an emergency physician and save lives and do a resuscitation, or you're a geriatrician helping patients in the very last weeks or month of their life. It doesn't matter. We are here to take care of patients. But I think that research and scientific clinical research has to be part of what we do. And I want to encourage everyone to do research, because I mentioned this is how you impact lives of patients in very many places, in remote places, and you can touch the lives of many more patients than the ones you see in front of you in the clinic. Quality improvement and making sure, like a little bit like the Toyota type of Kaizen. You want to improve what you're doing. You want to reduce waste and make better decision-making for patients. Don't give antibiotics if it's not necessary. Don't do tests, because if you do too many tests, you will find something that is incidental. I mentioned education. We talked about it a lot. I don't have to tell you, Junji Sensei, and you've been all your life doing education. And finally, not least important, but in the end of the line here, is being involved in leadership and administration. I want to encourage people here to look at those opportunities as well, because we always need new leaders. Old people move on. They retire or go to other places. We don't see them anymore. You need people to have some leadership skills, and you don't have to be born a leader. You can learn how to be a leader. And we need people to work around the administration, improving processes, improving the education, getting programs in place, and so on, getting funding, getting money to do all those things we need to do. So please, yes, clinical work is what we're designed to do, but all those other pillars, big, strong foundation to our job, is also important.
Yeah, I agree. And particular administration and the leadership is particular to changing the system, Individually, patient care we can change, but change the system, good leader, administrator is very, very critical, I think.
I agree with you, and I can't emphasize this enough, but people are sometimes afraid of leadership. They
Yeah.
think, oh, me, I cannot be a leader. I wasn't born to be a leader. No, it's not something you're born with. You can learn to do that.
Mm.
Well, let me briefly tell you why I do research, why I said it's important. Because research is bringing new data, new information. And I was lucky to also do some research with people from Japan. Research in Japan is growing. Japan is one of the leaders in basic science research and is moving rapidly to improve their clinical research. And here are examples of some studies that were published by Japanese investigators. Those are all clinicians that worked hard to do research as well. Here is an example of working in teams. We worked with teams in multiple countries to learn more about corona and corona vaccine. And we were lucky to have one of the sites in this collaborative from Tokyo, from Japan, and Shimizu Sensei, a very good professor of pediatric and pediatric intensive care unit, has been gracious enough to be involved in this research. And we were able to work together in multiple countries, including Japan, in learning what parents think about the corona vaccine, which was very important for decision makers. How do you promote getting vaccine for corona? So, we have a lot of changes that had happened over time. People gain more confidence in emergency pediatrics. We have more nurses involved in care of children in the Shawnee QQ. We are doing in the Shawnee QQ a lot of other new innovative procedures. And finally, we have networks of people working in Shawnee QQ. And I hope that more and more Japanese doctors can come here to Vancouver to work with us and see what we're doing. Let me finish by telling you about the yes theory.
Okay. Yes, theory. That's a nice word.
Yes theory, because I think we should say yes more. We need to be explorers. We need to open ourselves. And we talked about changes, right? We talked about taking opportunities and saying yes. We talk about being a leader. This is all being an explorer and learning about new things. I think what I've learned from Japanese doctors is to be humble. And, sometimes when we come out of medical school, we think we know everything. There's nothing else to learn. Over time, the older I get, the more humble I get that I don't know enough. And I think this helps me understand that I need to learn more. On the other hand, I think that while you need to be humble, you also need to be confident. You need to know, I have the skills to help my patients. I have the skills, or I can get skills to do research. You don't want to be overconfident and promise things you can't do, but it's okay to say, I'm acquiring the skills that I need. And I find that people are sometimes not confident enough, despite having lots of knowledge, working very hard, and getting the skills they need. They don't feel they have them. And finally, I think what I've learned over time is that you need to find mentors. And the more you find people that can help you, and it doesn't mean they have to tell you what to do, but mentors are people that will help you make the decision. They will guide you to a point where you yourself make the decisions for yourself. Don't expect anyone to be on the other side of the phone or the other side of the table and tell you what you need to do. No one knows you better than you. But getting the mentors and getting opinions is really important.
Yeah, that's true. I
would
have
love
a
to
very
hear what
good
you.
mentors in my life, but I'm sure you're gonna be the good mentor for many young generation, I think.
Thank you. Arigatou gozaimasu. I'm still learning. I enjoy the mentorship that I receive and the mentorship that I give, and both give me a lot of satisfaction.
I see. And thank you very much for your talk today. I'm sure many people, listeners, learn a lot from your, talk. And I feel, I didn't know your, past your personal history from Toronto to Vancouver, but now I understand. And say yes is probably very important, key word you mentioned at the beginning. And over here, I put this background. Don't say no, but say yes.
I love
uh,
it. I love it.
yeah,
Yeah.
and I'm glad you still continuously, doing a teaching between Canada and Japan, and hopefully more frequently you come to Japan. And I'm sure your influence to the young generation is great. So please continue doing so.
You're very kind.
Any final words?
I'm learning from a lot of people. I recommend to everyone to choose your path, but use the word yes while choosing your path.
Whenever getting opportunity. And another thing you said, you always you said humble, but teaching is really learning. You know, it's very good words. Teaching is learning, and I do like teaching, but also I learn a lot from the young generation. So continuously teaching I like, and probably same situation, but please, help young people in Canada and also Japan and all over the world from now on too. By the way, you go to Japan, but how about Hawaii?
Oh, I would love to see Hawaii. I have not been enough. And
Ah,
Hawaii is an amazing center for so many unique populations and
right.
conditions. Yeah, we should talk maybe
Yeah,
on the way to Japan. It's just a hop.
yeah,
I
that's right.
can
You can
drop
just stop by. And when
stop
you
by
come to
exactly.
Hawaii, I know this is a sign you have to use. It's called a shaka sign. This like a hello, aloha, thank you. You can say, you can use this one in Hawaii uh, everywhere.
Wonderful.
Thank you very much, Ran, and hopefully I can see you personally again, not just like video, but maybe we can meet together in Japan also.
Thank you for everything you're doing for junior, senior, in Japan, in Hawaii, and everywhere. Your impact is significant and has been for many years. So continuing the work that you do is phenomenal. Not many people can last that long in putting time and energy. So arigato gozaimasu.
Yeah,
Thank you
thank,
very
thank you
much.
very much. Thank you. So see you hopefully soon in person. Bye.